Welcome to the Health and Government Operations Committee. Today we'll be voting on vote list number 16, long list. The first bill is House Bill 1241. Is there a move to let the sponsor withdraw her bill?
So moved.
Second.
Second, thank you. Is there any discussion? All those in favor say aye. All those opposed, no. Please raise your hand, and I'm going to open the participants box so that I can see hands. Oh, come on, really? Okay, she will be allowed to withdraw the bill. Thank you. Let me try and get my screen working the way I want it to so I can see things here. Excellent. Okay, we'll now move on to House Bill 80. Erin.
This bill requires the community options waiver to include a cap on participation in a plan for waiver participation of at least 7,500 individuals. If MDH maintains a waiting list or registry for the waiver, each month MDH must send a waiver application to at least 600 individuals on the waiting list or registry. A waiver application must state clearly and conspicuously that the applicant must meet the application within 6 weeks of receipt and has to meet all eligibility criteria for waiver participation within 6 months of application submission. There is an amendment on page 1 of your packet that conforms the bill to Senate Bill 28, and it provides that by October 31st, 2022, MDH must apply to CMS for an amendment to increase the waiver cap size to at least 7,500 individuals.
Delegate Penny-Melnick.
We have had this bill for as long as I can remember. This bill will help people that really need the help, the most vulnerable. The department actually has 2 pins that they have not fulfilled. There are also some additional pins for them this year as well. And this will be a great way to motivate them to make it a priority and finally get it done. So the vote on this was unanimous in the subcommittee.
Would you like to move the bill?
Delegate Collison has a question.
Oh, Delegate Collison.
Thank you, Madam Chair. I just, for the benefit of the public who is watching, first of all, I want to thank the chair and vice chair for their help with this bill, and to let folks know that this is going to help our most vulnerable seniors and disabled stay in their homes as opposed to going into a nursing home before they need those extreme services of a nursing home. So with that, I move the bill.
Let's go
Move
with
the amendments
first.
Oh,
Yeah.
I'm sorry. Move the amendments.
Thank you. Is there a second on the amendment?
Second.
Yeah.
Discussion? All those in favor say aye. All those
Aye.
opposed, no.
Aye.
Please raise your hand in the panel. The vote is unanimous on the amendment.
I move the bill as amended.
Second.
Discussion on the bill as amended. All those in favor say aye. All the opposed say no and raise your hand in the panel. The vote is unanimous. There is an amendment. How many people would not like to be a sponsor, a co-sponsor of this bill? Is there anyone on HGO who would not like to be a co-sponsor of this bill? Okay, Richard, you need to make sure that we have the people who, is there anyone missing today?
Nick Kipke?
What?
Nick Kipke?
Delegate Kipke, are you here?
He's here.
Oh, he's here. I'm sorry.
Excellent, okay.
I'm here.
Sorry,
I'm here,
Nick, I
thank you.
didn't see you.
Yeah, the
Yep.
thing with having two screens of people makes it complicated. You know, it's the old joke of all those absent, please say absent, and there's nobody to say it. So I assume did you count the members, Richard?
Yes, and I will also let the LAs know who was missing. I believe Delegate Carr is missing.
Delegate Carr, are you?
We just
here?
arrived.
Good.
Gotcha.
Okay, do you want to be a co-sponsor of the wait list bill, Delegate Carr, with everyone else on the committee?
Sure.
I was pretty sure you did. Are anyone else missing? Okay, thank you. We'll all be co-sponsors of that really historic bill. And somebody needs to call Delegate Hubbard and tell him we finally passed it. House Bill 297, Aaron.
There is a reprint of this bill on pages 2 through 5 of your packet. The bill requires each state residential center to establish and implement a safety plan and revise the plan not less than every 5 years. In addition, each application for a certificate of approval for a private group home that is submitted to MDH must include a statement that the applicant will establish and implement a safety plan or implement a safety or emergency plan established for another purpose. In addition, facilities that are regulated by MDH under Title 19 of the Health General article must submit a safety plan by October 1st, 2023. And the Department of Juvenile Services must adopt regulations that require each juvenile care facility to establish and implement a safety plan or implement a safety or emergency plan that's established for another purpose.
Delegate Pena-Melnick.
The vote was unanimous.
Okay. Would you like to move the bill?
Yes, I moved
There are
the amendments. There are
Sorry. Yeah, okay.
I
The
move the
amendments are
amendment.
moved. Is there a second?
Second.
Discussion of the amendment? All those in favor say aye. All those opposed, no. Please raise your hands. The amendment passes unanimously. Delegate Pena-Melnick.
I move the bill as amended.
Second.
Any discussion? All those in favor say aye. All those opposed,
Madam
no.
Chair, we have one hand.
Delegate Krebs.
Delegate Krebs. Is that a question, Delegate Krebs? or
Yes,
a vote?
yes. I just wanted to ask, I know originally the
Sure.
Lori Doyle's group was opposed to it. Did that take away their opposition to the amendment?
Yes, they are fine with the bill as amended.
Okay, thank you. Just want to be sure.
Thank you, Delegate Krebs. Are there any other questions? I don't mean to miss you if you have questions. Okay, all those in favor say aye. All those opposed, please raise your hand. The vote is unanimous. House Bill 709. Lisa.
So there are amendments on page 6 in your packet. With the amendments, they strike the provisions that would have established a subsidies program and instead require the Maryland Health Benefit Exchange to convene a work group to study and make recommendations relating to the establishment of a small business and nonprofit health insurance subsidies program. The work group must make findings and recommendations regarding the objectives and target metrics, optimal scope and design features, cost of administration and sources and level of funding needed for the program. The amendments also include a provision expressing legislative intent that future funding be appropriated to establish and operate a small business and nonprofit health insurance subsidies program.
Delegate Cullison.
Thank you, Madam Chair. As the implementation of the Affordable Care Act has evolved over time, we've seen that one of the areas that is still struggling is our providing health insurance for our small businesses, making it more affordable for them. And this is a bill that the Health Benefit Exchange worked on with the advocates to say, we need to study how to do this in the best way possible. So that is where the bill gets us at this point. And I think we'll have a good product when we come back together in next January. And the bill was unanimous in subcommittee. Do I need to move amendments on this, Lisa?
Please.
Yes.
Move the amendments.
Second. Discussion, all those in favor of the amendment, please say aye. Opposed, please raise your hand in the panel. Seeing no hands, the amendment passes unanimously.
Move the bill as amended.
Second. Any discussion of the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see that the bill passes unanimously. House Bill 786. Aaron.
This bill would prohibit overdose information reported by an emergency medical services provider or by MIMS from being obtained by a law enforcement officer as part of a criminal investigation or prosecution. The requirement that a healthcare provider disclose a medical record without the authorization of a person in interest to grand juries, prosecution agencies, or law enforcement agencies or their agents or employees to further an investigation or prosecution pursuant to a compulsory process is subject to the limitations on patient overdose information reported by an EMS provider or MIMS that's being used for or obtained by a law enforcement officer as part of a criminal investigation or prosecution. There were no amendments.
Delegate Pena-Melnick.
In this bill, we actually, one of our members asked whether the bill was necessary, and we sought an AG letter. The AG letter actually stated that the House Bill 786 as introduced does not appear to sufficiently apply to the prohibition to an instance where an overdose record is held or maintained by EMS or MIMS. So they thought that the bill was necessary, and this is exactly what the bill does. We discussed it, and it was actually unanimous.
Would you like to move the bill?
I move the bill.
Is there a second?
I can't.
Any discussion on the bill? All those in favor say aye. All those opposed, no. Raise your hand. Bill passes unanimously. House Bill 975, Lindsay.
This bill establishes the Maryland Loan Assistance Repayment Program for nurses and nursing workers and an associated special fund for the program. The Maryland Department of Health must convene a stakeholder work group to examine how to incentivize nursing and nursing worker students to practice in specified areas, make recommendations on a permanent funding structure for the special fund, and make recommendations on priorities for funding loan repayment through the program. There are amendments that begin on page 9 in your packet that were adopted in Health Occupation Subcommittee. The amendments change terminology in the bill from nursing worker to nursing support staff, clarifies the definition of nurse, removes a requirement that loan repayment be made to nurses or nursing support staff who practice primary care and in a geographic area of the state that has been federally designated, removes language relating to the priorities for funding loan repayment through the program, and instead requires the department to establish priorities by regulation with advice from the stakeholder work group, removes language that would have required the Board of Nursing to fund the program, and adds members to the stakeholder work group.
Delegate Kelly.
Thank you, Madam Chairman. This is important legislation to address the particularly nursing workforce shortage, which is critical in the state of Maryland. The initial funding for the program was already put in the governor's budget, so this is just setting up the parameters for the program, the amendments, and the bill passed unanimously. Move the amendments.
Second.
Is there discussion on the amendments? Does either Delegate Kelly or if not Delegate Pena-Melnick know how many vacancies there are for nurses in hospitals today? Does anyone have any statistics on this, just because I'm curious?
Delegate Kelly, you can go ahead.
Oh, no, if you have them in front of you, go ahead, Delegate Pena-Melnick. I will say, I think I saw a 35% number off the top of my head, but I don't have them right in front of me. But it's massive.
Yeah, 1 second. I have
35%, I think, of all healthcare workers.
I didn't mean to surprise you with that, but it just
That's
occurred
okay.
to me that it would be good to have that number.
Yeah, I actually currently 23.5% of nursing and medical positions are vacant. That's an increase of nearly 35% since late summer. And vacancies among licensed practical nurses rose a staggering 135%. Hospitals report that roughly 1 in every 5 hospital staff positions overall is vacant. These shortages result in delayed care and longer emergency departments wait and transfer time, which threatens the access and quality.
Thank you,
And that's-
Pena-Melnick and Delegate Kelly, both. I appreciate that. And Delegate Kelly, you may want that for the floor.
Yeah, I do have it. Thank you.
Good. Is there any discussion beyond that? All those in favor of the amendment, say aye. All those opposed, no. Please raise your hand. I see no hands. The amendment passes unanimously.
The bill is amended. Second.
Discussion on the bill as amended. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 1105.
Madam Chair, can we do a sponsor amendment on that one?
We could. Where did that come from?
Delegate Bagnall.
Thank you, Delegate Bagnall. Is there anyone who doesn't want to be a sponsor, co-sponsor on that bill? Anyone? I see no hands. I hear no voices. Everyone will be a co-sponsor on that bill. House Bill 1105, Lindsay.
This Was on the voting list last time we met last week. The bill establishes a definition of first responder for use in the public safety article, establishes specified rights for 911 specialists related to occupational well-being, and requires counties to classify 911 specialists as first responders, modifies the Maryland 911 Board's procedures for filling vacancies on the board, and requires the board rather than the governor to select a chair and vice chair, expands the Maryland 911 Board's responsibilities relating to the development of training standards, including required implicit bias training and implementation of cybersecurity standards by public safety answering points, establishes requirements for the comptroller related to audits of surcharge collection and remittance of 911 fees by telephone companies and commercial mobile radio service providers, repeals the limit on the maximum charge for the county 911 fee, and requires a county that increases the fee to certify the amount to the Maryland 911 Board and no later than 60 days before the implementation of the change to the comptroller. There were amendments adopted in Government Operations Subcommittee that begin on page 20 in your packet that require the implicit bias training once every 4 years after initial training at time of hire or by October 1st, 2024 for existing personnel. Strike the requirement that a jurisdiction pay 911 specialists an amount that exceeds the state minimum wage. Requires the state 911 board to submit its annual report to EHE and HGO and include certain additional information in its annual report for 2022 through 2027, and requires the Maryland Department of Emergency Management to summarize and analyze information from that report to the committees and make recommendations.
Delegate Rosenberg.
Thank you, Madam Chair. This was not unanimous. I believe that it's fair to say that the reason for that is that the bill does allow for local government to impose an increase in the fee. The majority supported that for two basic reasons. One, it is a local decision, and therefore those directly affected are in a better position to make it known whether they support or oppose it. And then in addition, and it would also be under the amended bill up to the local government to decide what the salary is for these individuals providing the 911 service. And finally, there is a annual audit of how the money is spent. And the amendments offered today would provide that the Department of Emergency Management conduct that audit because they have the resources to do such an evaluation, which is not the case with the 911 board. So we would move adoption of the amendments, but there is a move the adoption of the amendment.
Is there a second?
Second.
Is there discussion on the amendments? Is it true, Delegate Rosenberg, that when the audit is done, one of the things at least that would be looked at would be that the monies raised were spent entirely on 911 services?
Yes.
So when the local government would have to justify why they are raising a fee.
Yes, thank you.
Thank you, Delegate Krebs.
Thank you. And I don't want to belabor this, but as I said last week, we haven't even collected a whole year's worth of the extra fees. And some counties have already doubled it. My concern is with the smaller counties about, they're going to have to keep raising their fees for their own people over and over to meet some of their requirements, I believe, based on the preliminary information. Some of the smaller counties just don't have their people are going to be paying way more than some of the big counties that have economies of scale. I think there's a better way to do this once the reports come out, because I think at the end of the day, you might have a Caroline County, a Dorchester County, that their fees are going to keep going up and up and up so that they can make their operational costs. And some of the big counties, I know Baltimore, I found out some information, Baltimore County is already close to meeting their operating just with the current fees. I mean, that's how well it's going for the big counties. I think it's premature to just to sort of force the smaller counties to keep raising their fees and not look back and say, will the state fund have extra money to give to some of these smaller distressed counties? And until that evaluation is done, we're giving carte blanche. We're not really giving carte blanche. We're putting pressure on the small counties to raise their fees to their constituents. And I think it's unfortunate. So I wish we would have the report first. again, the dust hasn't even settled on the fees. And I was the sponsor of the bill to double the fees and to put them on every phone line. And that's a huge amount of new resources. And I put my name on that bill a couple of years ago. It's just being implemented and they're just getting the extra fee money in. But some of the small counties are not going to have the volume of users, phone users, to cover their fees. But the state fee, there might be money left in the state fund to help give them some help. But instead, we're sort of pushing the local counties to keep raising their fees on some of those smaller distressed counties. And I just think it's premature to allow this, or I say allow it, to sort of encourage it and not find a better solution for some of the smaller counties. But I'm not gonna be here next year to evaluate this. I just wish there was a pause on that piece of it until the information came in. I like to do the analysis before I give the permission. So anyway, I'm going to vote no. There's a lot of good stuff in this bill, but that's a big deal to me for some of the small counties. And I just, I always stand up for the little guy. But thank you for the reporting and the other tweaks that were made that makes this a better bill and does at least have some oversight next year after some of these guys are raising their fees. That's my take. Thank you.
Delegate Shalega.
Thank you, Chair Pendergrass. So I had asked in subcommittee how much money was in the state fee, and we didn't know. And that would be a good thing to know because that's where I was going with it. If the state fund is flush, then it would be appropriate for them to help the smaller counties who, for obvious reasons, have many, many, many more miles to travel and fewer people in them. So I wish that we were doing that instead of putting this pressure on the small counties. Thank you.
Delegate Sample Hughes.
Madam Chair, I just needed to get clarity from Delegate Rosenberg, and sorry I didn't get a chance to ask this in committee, but what was the final decision with Maryland Association of Counties as far as their position on it? Were they still concerned and opposed?
I believe we addressed their concern.
You did, okay. Thank you, Con. Thank you.
Delegate Johnson.
Thank you, Madam Chair. And I just had some input on Delegate Shalega's question. For instance, Harford County, even if they went to the max 150, they would still be about $2.1 million shy of covering the cost. So I too had a question that did the state have any money to put in to some of the counties that did not have as many people?
That did not come up in our committee considerations. I don't know if, Lindsay, if you have that information or that's something we can
I don't
ask
know what their budget,
for the
what their
floor
fund
debate.
balance is.
I did ask the question.
I just wondered if we maybe knew that, but I guess we don't know that just yet.
Well, we'll endeavor to have it before the floor.
Delegate Rosenberg, do we anywhere say that the county must do this, or could a county use general funds to subsidize this program if they didn't want to raise that fee?
That's certainly a decision they could make. There is no prohibition.
Thank you, Delegate Rosenberg.
Thank you.
Okay, so would you like to move?
Move the amendments.
I think we did that, and I think we
Okay,
seconded them.
that's right.
We must be on discussion. So with that, all those in favor of the amendment say aye. All those opposed, oh, Delegate Shalega, is your hand up to vote, or do you have another question?
Yeah, I had a question, and I don't know if the full committee would be interested in putting a cap on that fee instead of, you know, an uncapped increase. I think we'd probably get unanimous or near unanimous support if we knew there were, for your bingo card, the word guardrails, if there were guardrails put on the fee increase. I don't know if it's too late, but since the whole committee is taking a look at it, and we do have people here and on the committee from smaller counties, you know, that may satisfy some of our concerns.
Delegate Rosenberg, was that discussed in the subcommittee?
I don't recall it's being discussed. I mean, we could also say as part of the report language, specifically ask about, the impact of the fee or these other options.
I don't think that gets at the
Yeah.
immediacy of what the request is about. So I don't think the study is solving that problem. Delegate Kaiser.
Thank you, Madam Chair. And to add to Delegate Shalega's bingo card, I'll say a local control. And I think this is an opportunity for the locals to set the price that they need and to demonstrate the challenges they might have. And the advantage to the report language that was put in allows all of us or whoever is here in the future to look at this and see if the economies of scale that Delegate Krebs spoke of or any of the other problems exist. And then we have the information potentially to add those guardrails in.
Delegate Hill.
Thank you, Madam Chair. So a couple of things. First of all, MACO supports the bill. The small counties want that change. It is not in their interest to raise fees that their constituents, their residents can't handle, but it gives them some flexibility while we're looking at the numbers. I appreciate Delegate Krebs' points that she also made on the commission about can we just wait and get the numbers. I sent out information before. 4 counties have charged the maximum fee and aren't making it. 2 counties have raised their fee, but they're not at the max. I don't think in the next year we're going to see an overwhelming push and pull from any county to suddenly raise the fees further, but it gives them some flexibility because they've got to deal with all of their budgetary issues. And as Delegate Kaiser said, we are then getting the information. The state will be able to look at, including MDEM and including the board, if they're covering with their fee, if they can now give grants, if they can cover personnel. There are certain limitations to what they're able to do with the funds that they raise. Their suggestions may be that we ought to be able, again, to cover different things that the local PSAPs need. But I don't think it makes sense to not give them the flexibility that they need in the next year, nor do I think that we should be expecting if the majority of districts or jurisdictions haven't done the maximum allowed fee in the last 3 years. There's no reason to think that in the next year, all of a sudden, every jurisdiction is going to raise their fee and voters be damned. I just think that that's a little excessive fantasizing.
Delegate Kaiser.
5 words. The small counties want this too. Thank you.
Delegate Bandari.
Yeah, thank you, Madam Chair. To Delegate Saliga's valid point, I was looking through the bill on the fiscal notes. I don't know whether it satisfies or not. Towards the end, it says, I don't want to read everything. When combined with the existing local 911 fee of $75 per month, the local government may charge a maximum of $1.50 per month under these circumstances. Is that the cap? Not sure.
Delegate Rosenberg.
We are removing the cap.
Okay.
Delegate Krebs.
One last bite of the apple. In the past, everyone in the state paid the same 911 fee. They all paid $1, 25 cents and 75 cents. Everybody was the same. Part was state, part was local. With all this new stuff that we're doing, we need more revenue. And the way we've done it is by expanding it to every single phone line, which is a lot, and then allowing everyone doubling the fee. And we've already done that. But again, it hasn't been implemented for a whole year yet. They haven't even done the studies on it. So this just allows us to raise it to unlimited, whatever you need. The reason that the small counties want some way to be able to backfill their budget for these costs. And I get that. My issue is it shouldn't be on the backs of their phone users different than everyone else in the state. I believe that there's another way. There is money in the state fund, and there's nothing in this language that says, hey, let's reevaluate the state fund and then deploy some of that excess money to these distressed or smaller counties. Because right now you're going to have an option. I mean, different counties are going to have different assessments on their citizens for their phone usage. And it's never been like, it's always been the same. And I think there's a better way to be able to disperse the excess revenues to the smaller counties that cannot, they want the ability to cover it in their budget. And I get that. And right now, this is the only thing we're offering to them. So of course, they're going to say, yes, give us that ability. If you ask them if they'd rather get some kind of a grant to backfill them instead, they certainly would take that instead, but that's not an option that we've offered them. So I understand why they support it, because it's the only offer on the table. But I just think it's unfair for people maybe in Somerset and Dorchester and Allegheny and Garrett to pay a way different fee than the people in a large county with a lot of users. And that's just my personal opinion. It's never been different before. It's always been the same, but that's my piece. Thank you.
I would just add that is certainly the option when we look at this bill, if it were to pass in its current form as amended, that we could look at the option of reimbursing local jurisdictions for, if the evidence was there that they had paid in excess and it was an unfair burden. That's something that could be done next year when we have greater information in light of the report and audit that is being mandated by this bill. We can do that then.
All those in favor of the amendments, please say aye. All those opposed, no. Raise your hand. The amendment, Delegate Banderi, Saab, are you voting against the amendment?
I'm sorry, I thought you were on the bill.
What is going on? Try again, Delegate Saab.
I'm sorry, I thought you were on the bill, not the amendment.
We are not on the bill, we are on the amendment. We haven't begun to debate the bill. Delegate Saab, I see your hand up. Are you voting against the amendment?
Nope, I'm good.
The vote on the amendment, it passes unanimously. Delegate Rosenberg. Move the bill.
I move the bill as amended.
Second.
Any discussion left to have on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hands. I did hear you say aye, Delegate Saab, and then I did see you raise your hand. I think, maybe it wasn't you. Okay, good.
No, I'm voting no on the bill.
That's fine, as long as I'm not confused and getting the wrong vote here. Okay, I'm going to say the names. Delegate Krebs, Delegate Chisholm, Delegate Kipke, Delegate Riley, Delegate Shalega, Delegate Morgan, and Delegate Saab are voting no on this bill to allow counties to have the authority to raise a fee to pay for a service. Correct?
Yes, ma'am, got it.
So the bill passes. We will now move on to Senate Bill 3. Aaron.
There is an amendment on page 34 that would conform Senate Bill 3 to House Bill 297, which was just passed earlier on this voting list.
Delegate Peña-Melnick.
I move the amendments.
Any discussion? All those in favor, please say aye. All those opposed, no. The amendment passes unanimously. The bill is now in the posture of the bill we've already passed, the House bill. Is there someone?
I move the amendment.
No.
I'm
move
sorry,
the
I
bill.
move the bill. Move the bill.
Thank you. Is there any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The ayes have it, and the bill passes unanimously. Senate Bill 28. Aaron.
Is identical to House Bill 80, which was just passed earlier in this voting session.
Move the bill.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 133, Lisa.
There is an amendment on page 35, and with that amendment, this bill is identical to its cross-file House Bill 21.
Move the bill. Is there a second?
Second, do we need to move the amendments?
Oh, sorry. Yes, I missed that.
Sorry.
Would you move the amendment?
Move the amendments, Madam Chair.
Thank you. Any discussion on the amendment that makes the bill the same as the House bill? Seeing no hands, all those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously. Senate Bill 133, Delegate Kelly.
Move the bill?
Yes. Is there a second?
Move the bill as
What?
Move the bill as amended?
Well, it's the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 168, Aaron.
This is a departmental bill that repeals the exemption from certain Immunet requirements for a healthcare provider who administers vaccines in a nursing facility, an assisted living program, a continuing care retirement community, or a medical daycare program. The bill also alters the membership of and term limits for members of the statewide Advisory Commission on Immunizations.
Delegate Penny-Melnick.
Thank you, Chairman. So this bill was actually a bipartisan vote. There was only one person that did not vote for it. And what the bill does is that if you administer the vaccine, which these facilities did during COVID, and they did not have a problem doing so, who administer vaccine in a nursing facility, in an assisted living program, a continuing care retirement community, or a medical daycare program, they would be required to submit that data like everyone else. And then the bill alters the membership and adds two other members to the State Advisory Commission on Immunization. I move the amendments.
Second.
Is there an amendment on this bill?
Was there?
Aaron, is there an amendment?
There
on
were
this?
no amendments
No,
on
I'm
this bill.
sorry. Yeah, I moved the bill. Move the bill.
Second.
Is there any discussion on Senate Bill 168? All those in favor say aye. All those opposed, no. Please raise your hand. I see one no vote, Delegate Shalega, and everyone else will be recorded green. Senate Bill 174, Aaron.
This is also a departmental bill that extends the termination date by 10 years of specified provisions relating to the Mortality and Quality Review Committee, including that the committee must review specified aggregate incident data and include such data in its annual report, make findings and recommendations to MDH on system quality assurance needs. It also provides that the Office of Healthcare Quality must provide the committee with certain data, and that the Developmental Disabilities Administration must provide the committee's report to specified facilities and programs. There are no amendments.
What?
There are no amendments.
Delegate Penny-Melnick.
So this basically will allow the Mortality and Quality Review Committee to continue to do its work, very important work and data analysis for 10 years. I did ask Ms. Check from the department why 10 years. She said that's just standard for what we request. The bill actually was unanimous. And there are no amendments, so I move the bill.
Second.
Any discussion on Senate Bill 174? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 180, Lisa.
This is an emergency departmental bill that authorizes the Maryland Insurance Administration to enforce provisions of the No Surprises Act and other provisions of the Federal Consolidated Appropriations Act of 2021. There were no amendments.
Delegate Cullison.
Each year, the Maryland Insurance Administration needs permission from this legislature to enforce federal regulations, and that's what this bill does. And it was unanimous in the subcommittee. Move the bill.
Is there a second?
Second.
Is there any discussion? All those in favor of Senate Bill 180, say aye. All those opposed, no. Please raise your hand. I see no hands. The bill passes unanimously. Senate Bill 185, Lisa.
This departmental bill authorizes the insurance commissioner to direct that a Maryland Insurance Administration hearing be held virtually. The hearing must be considered open to the public if a member of the public can observe the hearing virtually through an electronic media platform. The commissioner may not require a party to participate virtually in a hearing if the party demonstrates that it is unable to exercise specific rights related to the hearing by appearing virtually. Finally, the commissioner must make available to the parties to a virtual hearing a space within MIA with access to the equipment necessary to allow the parties to participate in the virtual hearing. There are no amendments.
Delegate Cullison.
Thank you, Madam Chair. This is a bill that is where the MIA is moving towards virtual hearings on all of the public, whenever it needs public input. And they're willing to make accommodations for those who need them and provide technological platforms for those who need them. And the bill was unanimous in the subcommittee. I move the bill.
Second, thank you. Is there any discussion on this bill? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. The bill passes unanimously. Senate Bill 186, Aaron.
This is a departmental bill that establishes a Maryland AIDS Drug Assistance Program Fund to support the administration, operation, and activities of the Maryland AIDS Drug Assistance Program. The Department of Health must administer the fund, which consists of rebates received by MDH from MADAP, money appropriated in the state budget to the fund, interest earnings on the fund, and any other money from any other source accepted for the benefit of the fund. MDH must deposit any rebates from a source other than a federal source received from MADAP into an account within the fund to be used only to fund state identified priorities for HIV prevention, surveillance, and care services. There are no amendments.
Delegate Penny Melnick.
So basically, this brings Maryland into compliance with federal regulations around maximizing funds for the program before they receive federal funds. The program has not been receiving interest earned on the rebate funds, and this bill just corrects that.
Would you like to move the bill?
Yes.
For a second?
Second.
Is there any discussion? All those in favor say aye. All those opposed, please raise your hand. I see no hands on the panel. The bill passes unanimously. Senate Bill 195, Lisa.
As introduced, this departmental bill extends the termination the termination date for the State Board of Examiners and Psychologists by 10 years. As amended in the Senate, it extended the termination date by 2 years. There's amendment on page 36. And this amendment that was passed by the Health Occupations and Long-Term Care Subcommittee moves the termination date back to 10 years.
Delegate Kelly.
Thank you, Madam Chairman. So this amendment and the bill passed unanimously. The committee felt that 10 years was appropriate. There were no deficiencies, and we recognize that either committee can request a detailed review at any time during the 10-year period. So we felt comfortable with restoring it to 10 years. Move the amendment.
Second.
Discussion. All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
Move the bill as amended.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 195.
You just did.
Oh, I'm sorry. I was looking at the last bill. Okay. Turn the page. Senate Bill 200.
No, you need
196.
Senate Bill 196, the last bill on this.
Oh, I'm sorry. Yeah, I'm reading it wrong. I apologize for being tired. Aaron.
This is a departmental bill that alters the requirements for the data-informed overdose risk mitigation report by removing and amending certain terminology. The bill extends the termination date for the report from July 31st, 2022 to July 31st, 2021.
Delegate Penny Melnick.
Thank you, Chairman. Thank you, Aaron. So in 2018, we passed this bill, and this bill basically extends the department's ability to collect this data. And the good thing about this data is that it helps them profile like who's at risk of overdosing. It reduces the mortality and overdose. So it's a good bill.
Would you like to move the bill?
Yes.
Second. Is there any discussion? All those in favor say aye. All those opposed, no. Please raise
We're
your hand.
tired.
Yeah, it's been a long day. I see no votes. The bill passes unanimously. Now we'll move on to Senate Bill 200. Aaron.
This is a departmental bill that requires the prescription drug monitoring program to monitor the dispensing of naloxone medication. It establishes standards surrounding the disclosure of naloxone medication data and applies the PDMP statute to naloxone medication data.
Delegate Rosenberg.
Pena Melnick.
Penny Melnick.
This is me again. This was unanimous. Do we have amendment on this bill, Aaron?
There are no amendments.
Okay, I move the bill.
Second.
Any discussion? Delegate Kipke.
Thank you. Just, I'm not on the subcommittee, but I'm curious. I don't remember the hearing. Why is it necessary for this to be a part of that monitoring?
You want to go ahead, Aaron?
I believe they were just wanting to track the incidence of when naloxone was prescribed. It just helps better provide data for when it's used. And there's information about in the bill that it's confidential and that it's only to be used for public health purposes, public health surveillance, research analysis, public reporting, and education. There was no, I know you've worked on this before, and there was no issues brought up from MedChi or any of the parties who testify on PD.
All right, thank you.
And if I may, I found some notes from the hearing, and Heather Scheck was present in the subcommittee, and she says that this will be filling an identity gap and that there's no patient level data collected. And basically this is for the PDMP use only, and the data use, it's in the aggregate fashion to direct resources to the hot spot. This is why it's needed. And those were her words during the subcommittee.
Okay, that makes sense. Thank you.
My pleasure. Sorry, it took me a little while to find my notes. Thanks.
Thank you for the question, Delegate Kipke, and the good answer from both Aaron and Delegate Peña-Melnick. Is there any further discussion on Senate Bill 200? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 202, Lisa.
This departmental bill extends the termination date for the State Board of Examiners in Optometry. This is the same story as you just heard for the Board of Psychologists. There's an amendment on page 37 that would move the termination date back to 10 years.
Delegate Kelly.
And no deficiencies, and the subcommittee felt this appropriate, so I move the amendments.
Second.
Any discussion? All those in favor of the amendment, please say aye. All those opposed, no. Raise your hands. I see no hands. The amendment passes unanimously.
Bill is amended.
Second.
Discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 207, Lisa.
This departmental bill adopts the National Association of Insurance Commissioners Data Security Model Law, which establishes data security standards for insurance regulators, insurers, and other specified carriers. Provisions of the bill are severable, and the purpose of the bill is to establish standards applicable to carriers for data security, prompt investigation, and notification to the insurance commissioner of a cybersecurity event. There are no amendments.
Delegate Cullison.
Thank you, Madam Chair. So the National Association of Insurance Commissioners has work to create a national standard of cybersecurity for information held by insurance carriers. And so this bill would allow us to adopt it. The MIA has worked closely with our carriers in order to make sure this bill meets all of their needs, and everyone is in support of it, and it was unanimous in the subcommittee. Move the bill.
Is there a second?
Second.
Any discussion on the bill? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. Senate Bill 207 passes unanimously. Senate Bill 209, Lisa.
So this is the last of the sunset bills on today's voting list. It extends the termination date for the State Board of Physical Therapy Examiners. There's an amendment on page 38 that moves the termination date to 10 years.
Delegate Kelly.
Story, no deficiencies. Subcommittee felt it appropriate. Move the amendment.
Is there a second?
Second.
Any discussion? All those in favor of the amendment, please say aye. All those opposed, please raise your hand. Seeing no hands, the amendment passes unanimously.
Move the bill as amended.
Second.
Any discussion? All those in favor, please say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 380. Aaron.
This bill, there's an amendment on page 39 that would conform the bill to its cross-file House Bill 49, which passed unanimously.
Delegate Penumelnik.
It's just a cross-file. It didn't go back to subcommittee.
Oh, I'm sorry. Okay, so we're
Move
just
the bill.
conforming this. Thank
Correct.
you, Delegate Kipke. Is there a second? All those in favor of the amendment to conform the bill, please say aye. All those opposed, please raise your hand. The amendment passes unanimously.
Move the bill.
Thank you. A
Second.
Thank you. All those in favor of the bill as amended, please say aye. All those opposed, raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 394. Aaron.
This is an administration bill that broadens the existing requirements and protections related to the administration and provision of naloxone to encompass an opioid overdose reversal drug that is approved by the U.S. Food and Drug Administration. The bill also allows for such reversal drugs to be offered to specified individuals free of charge by multiple providers, programs, and entities, which are generally required to establish protocols. The Maryland Department of Health must purchase and then provide FDA-approved opioid overdose reversal drugs at no cost to the entities who may provide the reversal drugs only if MDH provides them. The bill also authorizes a cardiac rescue technician, an emergency medical technician, or a paramedic while providing EMS services to offer an FDA-approved opioid overdose reversal drug to an individual who received treatment for a non-fatal drug overdose or was evaluated by a crisis evaluation team.
Delegate Penumelnik.
So the testimony that we received from Ms. Rickard was that the opioid and overdose crisis claims the lives of about 7 Marylanders every day, making it one of the deadliest public health challenges. And the naloxone can safely and effectively reverse an overdose. And it's effective when you actually distribute it. And it's a really important bill for this community. So I move the bill.
Second.
Thank you. Is there any discussion on this bill? All those in favor, please say aye. All those opposed, please raise your hand. I see no hands. Senate Bill 394 passes unanimously. Senate Bill 568. Aaron.
This is identical to House Bill 786 that was just passed earlier during this voting session.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously, as did its cross-file. Senate Bill 632, Lisa.
This bill is identical to House Bill 709 that was passed earlier this voting session.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. Senate Bill 632 passes unanimously. Senate Bill 633, Lindsay.
This bill with the amendments on page 40 is identical to House Bill 1105, which you all voted earlier this voting session.
Move the bill.
Second.
The amendments on page 40.
Oh, amendments, excuse me.
Sorry, Madam Chair. Move the
That's all
amendments.
Second.
Any discussion on the amendment? All those in favor say aye. All those opposed, please raise your hand. The amendment passes unanimously. On the bill that's identical to the one we passed earlier, is there a move?
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. I see, wait a minute. I see hands in the panel or on the
Right.
screen or somewhere here. I see no votes. Delegate Krebs, Delegate Riley, Delegate Morgan, Delegate Chisholm, Delegate Shalega, and Delegate Saab. Any other noes?
Please, Madam Chair, this is Kip. Please count me as a no as well. Thank you.
Thank you, Delegate Kipke. We will add you as a no, even though apparently your app doesn't work for raising your hand. That's fair enough. Have you got that? I never can keep straight if that would be Lindsay or if that'd be Richard. Whoever's doing the tally, have you got?
It's
that?
Richard.
Okay,
Yes,
so
this
there
is-
are 1, 2, 3, 4, 5, 6, 7 no votes. Is that what you have?
Yes, ma'am. Sorry, I was looking for the unmute.
Fair enough. Thank you very much, Richard. I know that that's a hard job to keep up with all this. All right, the bill passes. Senate Bill 661, Lisa.
Although it's not designated as a cross-file, this bill is identical to House Bill 1219, which passed unanimously.
And this is a bill that will ask the pharmacists to work with MIA to study how pharmacists can be reimbursed when they are not in a pharmacy setting. And this includes folks in our FHCQs and nursing homes. So I move the bill.
Is there a second?
Second.
Is there any discussion of the bill? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. Senate Bill 661 passes unanimously. Senate Bill 696, Lindsay.
With the amendments on page 44 of your packet, it will be identical to House Bill 975, which you all voted earlier this voting session.
Delegate Kelly.
Sorry, I lost my way. Move the bill as amended, please.
How about moving the
Move
amendment?
the amendments. Let's move the amendments.
Second.
Any discussion of the amendment? All those in favor say aye. All those opposed, please raise your hand. I see no hands. The amendment passes unanimously.
Move the bill as amended. Thank you.
Second.
Thank you. The bill's been moved and seconded. Any discussion? All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously. Senate Bill 700, Lisa.
This bill is identical to its cross-file House Bill 1389.
Tanya Melnick.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 707, Lisa.
This bill is identical to House Bill 912.
Move the bill.
Delegate
the bill.
Paulson. Is there a second?
Second.
All those in favor of the bill, please say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 734, Aaron.
This bill requires the Maryland Healthcare Commission by December 1st, 2024, and each year thereafter to provide a report to the Governor and General Assembly that must include an analysis of primary care investment over the immediately preceding year, including data stratified by zip code and county in relation to total healthcare spending over the previous year, ways to improve the quality of and access to primary care services, with special attention to increasing healthcare equity, reducing healthcare disparities, and avoiding increased costs, and any findings and recommendations. The Maryland Healthcare Commission must form a work group that includes specified stakeholders to develop the report, including by interpreting the results of the required analysis and making the recommendations. There are amendments that are on page 49 of your packet. These were offered by the Senate sponsor of the bill during the bill hearing. These amendments would add the outpatient settings of primary care nurse practitioner services and primary care midwifery to the definition of primary care, and would add to the work group a representative from the Maryland Nurses Association, the Maryland Affiliate American College of Nurse Midwives, and the Maryland Community Health System.
Delegate Pena-Melnick.
Thank you, Chairman. Thank you, Aaron. This bill is broadly supportive. It addresses a critical need in primary care. The testimony that was provided by Dr. Haft was that primary care providers provide 40% of all visit, and they're less than 5% investment in the healthcare. So what this bill would do is it would allow us to understand what is the investment that we have in primary care and look at the equity and see how we can have better outcomes. So I move the amendments.
Second.
Is there discussion of the amendment? All those in favor, please say aye. All those opposed, please raise your hand. Seeing no hands, the amendment passes unanimously. Delegate Pena-Melnick.
I move the bill, Chairman.
Thank you.
Second.
Any discussion? All those in favor, please say aye. All those opposed, please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 804, Lisa.
This bill is substantively similar, or actually exactly the same to House Bill 972. The difference is that the Senate changed the enactment date to July 1st. There are no amendments.
Delegate Kelly.
So we're gonna move this bill and then the Senate's gonna change our enactment date as well. So move the bill.
Second.
Any discussion of the bill? All those in favor say aye. All those opposed, no. Please raise your hand. I see no no's in the panel. The bill passes unanimously. Senate Bill 823, Lisa.
This is identical to House Bill 973.
Move the bill.
Second.
Any discussion of Senate Bill 823? All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. And the last bill of the day, but not the last bit of work, so don't leave, is Senate Bill 824. Lisa.
There are some technical amendments on page 50, but otherwise this is identical to its cross file. And the Senate will be making the same changes to the House bill.
Delegate Kelly.
Move the bill.
Move the amendments.
I'm sorry.
Any discussion? Is there a second? Did I hear one?
Second.
Second.
Thank you. All those in favor of the amendments, please say aye. All those opposed, please raise your hand. Seeing no hands, the amendment passes unanimously. Delegate Kelly.
Bill is amended.
Second.
Second.
Any discussion of the bill as amended? All those in favor say aye. All those opposed, please raise your hand. Seeing no hands, the bill passes unanimously. Now we have a couple of or four concurrences here, so let's go through them.
Madam Chairman, before we get to the concurrences, I note, and if I seem distracted, I apologize. I've just wanted to remember to say this. We didn't actually vote the amendments on Senate Bill 133. I couldn't get my finger on unmuted quick enough, so we moved the bill as amended, but I don't think we actually voted on the amendment. Is that correct, Lisa?
I thought we voted on the amendment, but.
Okay, I might be wrong. We may have voted on it.
I seem to have a mark that we did vote on the amendment, but let's just assume that if we voted for the bill, it had the amendment and we're all happy with it. And I think that
it was unanimous when it passed the House in identical form, so I think we'll be fine.
Thank you.
Thank you.
Okay, here's hoping we did it right, but assuming it's okay. The first concurrence is House Bill 972. Lisa.
So this amendment changes the enactment date to July 1st, which we just did on the cross file. This is the continuing care at home certificate of need exemption bill.
Is there any discussion on, let's start with, I move to concur. Is there a second?
Second.
Is there any discussion on the concurrence? All those in favor, please say aye. All those opposed, please raise your hand. We vote unanimously to concur. Senate Bill 28. Lisa.
So this is the pharmacist nicotine replacement therapy medication bill. The amendment alters the definition of nicotine replacement therapy medication by removing the words small doses of. And this is identical to Senate Bill 62 as it has already passed the House 134-0. So.
I will move to concur. Is there a second?
Second.
Any discussion? All those in favor, please say aye. All those opposed, no. Please raise your hand. Seeing no hands, we will concur with the Senate. House Bill 163, Lindsay.
This is the bill that was Public Information Act required denial of sociological information and distribution lists. The Senate is conforming the bill to the cross-file Senate Bill 373, which was discussed in Government Operations Subcommittee earlier today. The amendment removes references to the Public Information Act and instead requires an agency or entity who notifies a resident for eminent domain purposes to send notice to the General Assembly delegation where the property is located.
Move to concur. Is there a second?
Second.
Any discussion on concurring with the Senate?
Half a loaf, Madam Chair.
Congratulations. Good lesson to know, Delegate Carr. All those in favor say aye. All those opposed, no. Raise your hand. I see no hands. We have agreed to concur with the Senate. House Bill 279, Lindsay.
This is the bill on the Communications Outreach and Advocacy Program. The amendment is technical. It strikes a heading in the bill, and the Senate will be doing the same thing to the House bill. And that wasn't changed in the bill, and so it should never have been in there.
I will move to concur. Is there a second?
Second.
Okay. Is there any discussion? All those in favor of concurring with the Senate, please raise your hand. All those opposed, please say yes. All those opposed, please raise your hand. We unanimously agreed to concur. With that, was there something that needed to be announced at the end of this meeting?
Yes, we have.
What was that?
If I may, Chairman.
Melnick.
Thank you so much. We have a bill in the Public Health Subcommittee. It's the cannabis bill that creates the work group. The Senate took our bill and they added 2 additional members. So we have tomorrow on third reader, Senator Feldman's bill. And what we need to do is to have, which Aaron, thank you, Aaron, has drafted an amendment. It's a friendly floor amendment that would add those 2 individuals onto his bill so that we don't end up in conference. So it's just giving people notice that we will be doing that, adding the 2 additional members. It's the state police wanted to be added, and then another industry member as well.
It's a cannabis commission. It's like a U.S. cannabis commission.
Yes.
Okay, is there discussion of us doing a friendly amendment on the floor? Actually, there is, let's move the amendment, Delegate Peña-Melnick.
Okay, so I move the amendment to add those 2 additional members onto the Senate bill that will be on third reader tomorrow on the floor.
What's the bill number, please?
Senate Bill 788, I believe.
Are you looking it up, Delegate Szeliga? Because we will wait for you if you are doing that.
Yes, I am, and that is the right bill. Thank you.
Okay, do you have any question about that, Delegate Szeliga, or concern?
This is the one with the hemp issue where I got
Yes.
the hemp guy on? Yeah, okay,
Yes.
good. Yeah, that's fine.
Thank you.
Okay, is there any other discussion? That amendment has been moved and seconded. All those in favor say aye. All those opposed, no. Please raise your hands. The amendment passes unanimously, so we will offer that as a friendly amendment. I'm not sure we actually had to do that official process. I don't remember doing it, but since we're here, since we're voting, it seems a good thing to do. So you'll see that amendment on the floor tomorrow and no one will be surprised. With that, everybody, including me, have a good dinner and get a good night's sleep tonight because tomorrow is going to be an extremely long day, I believe. Thank you all for all your good work and all the hard work that there has been. And as we noted earlier somewhere, more bills came through this committee than ever before. It's been a huge number. They've been complicated bills as they usually are. And I'm very grateful for everyone's contributions. Before we go, I see a couple of hands up. Let me start with Delegate Kerr and then Delegate Landis and then Delegate Kelly.
We have our team photo in the morning.
Richard, do we have a photo scheduled for tomorrow?
Yes, ma'am, 9:45.
Okay, and it's either on the State House stairs in outdoors or indoors, right?
It will be outside at the State House stairs. If it rains tomorrow, then it will be moved inside.
Thank you for bringing that up and reminding all of us, Delegate Kerr. Delegate Kelly.
So health occupations usually meets immediately after session, but tomorrow we're going to meet immediately after the brief bill hearings. So I just wanted health occupations to know that because it's different from usual. So we'll have 2 floor sessions tomorrow. Before the second floor session, after the bill hearings is when health occupations will meet.
Delegate Kelly, I'm going to ask you this. What if the floor session is short?
I think we're waiting until after the bill hearings because we're expecting something from rules to come to subcommittee. Don't we have a bill hearings tomorrow coming from rules?
Yes, we absolutely do. Thank you for reminding me of that. Okay, so we need to do the hearing, and the hearing is scheduled for what time tomorrow, Richard?
Sorry, we haven't put it on the schedule yet. Yeah, we haven't scheduled it yet.
Let's schedule it for a little bit early, just in case we get out early, and we can always move it later, but we can't move it earlier. So this is important for the members to know. We're going to schedule it. We can't use the words immediately after session, can we?
No, ma'am.
So we have to have a time.
Yep.
So we're going to schedule it for 12:30. Let's schedule it for 12 o'clock. Let's be really optimistic and let's assume we may need to move it. How's that? Okay, so the hearing tomorrow will be at 12 o'clock or immediately after session, which I will announce on the floor. Okay, again, thank you.
Just so you know, those bills we haven't officially received yet. So the hearing schedule will have to be changed tomorrow morning after the bills officially come out of rules.
Okay, well, good. Then
just in
tomorrow
case someone's looking for it and doesn't know why it's not there. That's why.
Thank you. Thank you very much. Because we don't have the bills, we can't post a hearing, but we do need to move quickly at this point in time. And if there's some change, if we get word that it's going to be a long morning, we can certainly change the 12:30 or immediately after session. Or did I say 12 o'clock?
At 12 o'clock.
Okay. Okay, I'll keep you informed and it'll be on the website tomorrow when we have a little more information. So thank you all very, very much. And I'll see you tomorrow on the floor.
Madam Chair.
Oh, Delegate Kerr, you are funny today.
Just to be clear, it's.
Yes. Wait a minute, Delegate.
At 9:45, no color, we're not in uniform.
Do we have a uniform?
I don't know if we're wearing our Maryland flags or we're wearing, I don't know, pussy hats. I don't know. Then the floor is at 12 and then we'll have a hearing. I mean, the floor is at 10, a hearing's at 12, and then there's a subcommittee of some type in the afternoon. And then we're back on the floor. I just want no voting. Okay.
And then we'll probably have to vote at some point too.
Voting session tomorrow.
We expect to vote after second session sometime tomorrow. Probably there will be a gap and we'll vote. Okay?
Should wear our favorite ice cream colors. Pastels tomorrow. Okay.
Chocolate.
It's nice to see smiles on your faces. Have a good night.
Chairman's
everybody.
favorite ice cream flavor is what? Vanilla, right?
Actually, it's peppermint, but I don't do that for breakfast. I do vanilla.
Well, I don't have a peppermint outfit to wear. So.
Sure someone does out there.